Hello everyone, my name is Fatima Aisha. Welcome to my video presentation, Intracardiac Mass. Hello everyone.
Good evening. Tonight we bring you an in-depth look at a critical and rare medical condition, intracardiac masses. These are abnormal growths that form inside the heart and can lead to life-threatening complications if left undiagnosed or untreated. From silent symptoms to advanced diagnostic techniques, we'll explore how these masses are detected and managed. Let's dive into this fascinating yet vital topic. Intracardiac masses are abnormal growths or lesions found inside the heart. They can be life-threatening. But thanks to advancements in echocardiography, we are better equipped to detect and treat them early. These masses range from blood clots, known as thrombi, to tumors, both benign and malignant, and even infectious vegetations linked to endocarditis. These masses fall into three categories: tumors, either benign like myxomas, or malignant, such as rare sarcomas or metastatic tumors. Thrombi, blood clots due to heart conditions like atrial fibrillation or heart failure. Infectious masses, like vegetations from endocarditis, or sterile masses from conditions like cancer. Intracardiac masses not only in the heart's ventricles, but also in the atrial chambers. Understanding how these masses develop is key to recognizing and managing their risks. Intracardiac masses can form through various pathological processes. Myxomas, the most common atrial tumors, originate from abnormal growth of connective tissue, often attaching to the left atrial septum. Meanwhile, for thrombi, or blood clots, develop in the left atrial appendage, often due to stagnant blood flow in conditions like atrial fibrillation. Vegetations from infective endocarditis occur when bacteria or fungi infect heart valves, leading to clumps of microorganisms and immune material in the atria. These masses can disrupt blood flow, damage heart valves, or cause embolism when parts break off and travel to other organs. So, who is at risk? Patients with underlying heart conditions like atrial fibrillation or valve disease are more susceptible. Systemic issues such as autoimmune diseases like lupus and certain cancers also increase the risk. Intravenous drug use and central line catheters can lead to infections causing these masses. Sometimes these masses are even linked to genetic conditions. Patients with intracardiac masses may experience heart murmurs, chest pain, or palpitations. Obstruction of blood flow can lead to shortness of breath, fatigue, or fainting. Infections or tumors can cause fever, weight loss, or night sweats, while embolic events like strokes may also occur. Echocardiography, both transthoracic and transesophageal, plays an important role in diagnosing intracardiac masses. Thrombes are often detected in the heart's chambers or appendages, while vegetations, commonly linked to infections, are seen on valve surfaces. Transesophageal echocardiography, or TEO, offers exceptional detail, with nearly 100% sensitivity for identifying infections and tumors. Further clarity comes from MRI or CT scans, which help determine the mass's structure and whether it has spread to nearby areas. For suspected cancers, PET scans can identify metabolic activity and confirm malignancy. Definitive answers often require histopathology, examining tissue from a biopsy or surgical removal of the mass. For diagnostic criteria for intracardiac masses, usually from transthoracic echocardiography, reveal crucial features such as the size, shape, mobility, and attachment of the mass, like sessile, pedunculated, or infiltrative. In thrombi cases, it's associated with areas of stagnant blood flow often linked to atrial fibrillation or ventricular dysfunction. Vegetations, mobile, irregular masses on valves or endocardium. Lastly, as for tumors, myxomas typically have a stalk and are located in the left atrium. Metastatic masses may involve multiple chambers. A 42-year-old woman with no history of major heart diseases presented to her doctors with troubling symptoms: severe palpitations, shortness of breath, and irregular heart rhythms. Further tests revealed an alarming discovery: 2 masses growing inside her heart, attached to the interventricular septum, affecting both the left and right ventricles. This finding was made possible through advanced echocardiography. The transthoracic echocardiogram, or TTE, initially revealed 2 solid sessile masses attached to the interventricular septum near the apex of the heart, one extending into the left ventricle and the other into the right. These masses appeared dense, with no signs of calcification or cavities, and were firmly attached, not mobile or pedunculated. Advanced transesophageal echocardiography, or TEE, provided a clearer 3-dimensional view. The images confirmed the exact size, shape, and location of the masses, showing how they were compressing the surrounding cardiac structures. Notably, the masses did not obstruct blood flow, but their size and placement posed an immediate threat to the heart's function. These findings led to the grim diagnosis, which is metastatic malignant melanoma, a highly aggressive cancer that had spread from the patient's skin to her heart. With her symptoms, including severe palpitations and shortness of breath, rapidly worsening, and the masses located in critical areas, the medical team decided to move directly to surgery without waiting for confirmatory biopsies. Doctors from a multidisciplinary team, including oncology, cardiology, and cardiac surgery specialists, decided to act swiftly. Just 4 days after her admission, the patient underwent surgery to remove the masses. The procedure was a success. Histopathological analysis confirmed the masses were indeed malignant melanoma. After the surgery, her symptoms improved significantly. Her irregular heart rhythms disappeared, and she was referred to oncology for further treatment of her melanoma. This case highlights the important role of echocardiography and surgical intervention in managing rare and aggressive conditions like intracardiac metastases. Melanoma is notorious for its ability to spread. Involving the heart is rare but not unheard of. Studies show that up to 64% of melanoma cases can result in cardiac metastases. Unfortunately, these metastases often go undetected until symptoms worsen. Experts emphasize the importance of regular monitoring in patients with a history of melanoma. And that wraps up today's special report on intracardiac masses. From blood clots to infections and even tumors, these conditions can be life-threatening, but are often treatable with early diagnosis and timely care. Thank you for tuning in to Health Watch News. Until next time, bringing you the news that matters most. Back to the studio.